Hello there. So this video is going to go over the external and accessory structures of the eye. This is my favorite model to go over these. This one's kind of old. You notice its eye is a little yellow, looks a little jaundiced, a little tired, but that's okay. We're going to use it anyway. All right, so starting here on the outside of the eye, you notice that we have these upper and lower eyelids. Now in anatomy, we don't call them eyelids. We call them the palpebrae. So this is the superior palpebra and the inferior palpebra. The plural is palpebrae. Now, the meat here in the corners of the eye, here and here. The places where the palpebrae meet, each one is called a canthus. So here, this is the nose. So this is towards the middle of the nose. This would be the medial canthus. And over here on the outside, this would be the lateral canthus. Now, this isn't on your list, but you might see it inside your textbook. The space when your eyelids are open that you can actually see your eyeball in is called the palpebral fissure. So this opening here is the palpebral fissure. Okay, let's go back over here to the medial canthus. When you're looking at the medial canthus, there's a small swelling that's usually a dark red color. You can actually feel it. It's like a bony bump here in the corner of your eye, and that is known as the lacrimal caruncle. I know, funny word, but that's what it's called, the lacrimal caruncle. Okay, so big thing about our eyelids, right? They blink and they move so that we can clear our eyes of debris and stop things from getting in our eyes. Now, when you blink, your bottom lid does not move. So you notice that there is no muscle attached to the inferior palpebra. On the top, however, this is the one that does the moving. So if you look up here, there is a muscle right here. Now I'm going to turn this model sideways so you can see where this muscle is. Okay, so again, we're heading towards our upper lid. They kind of cut it away here so we could kind of see this. But this is that muscle, and it goes all the way back here. Now we're going to learn later that these other muscles are the ones that move the eyeball, but this muscle on top is the one that moves the upper eyelid, and its name is levator palpebrae superioris. Okay, so its name kind of tells you what it does. It levitates, levator, the upper lid, or the superior palpebrae. Okay, we are also going to talk about this coating. There's a coating, a layer, a clear membrane that goes inside the eyelid. So if I were to take this off for just a second, it would actually be lining this entire inner region here. Okay, now this coating also covers this white part of the eye. It does not cover this clear part, but it covers this white part of the eye in the front only. Now the entire covering is called the conjunctiva. And if it gets infected or inflamed, we call it conjunctivitis. You might have heard of it. It's called pink eye. But this covering is like a seal over the front of the eye. So it lines the inner part of the eyelid, and then it goes over the front of the eye. Now, when it's lining the eyelids, we call it the palpebral conjunctiva. So then it would be this inner pink layer inside. If it's on the eyeball, we actually call it the ocular or bulbar conjunctiva. Okay, so the bulbar conjunctiva would be here. This is the one we see for pink eye, and the palpebral conjunctiva would be in here. Okay, moving on. Now, all of us cry, right? We've cried at least one time in our life, and for some reason, we seem to think that our tears come from here, but actually the opposite is true. This very large gland up here on the lateral outer corner of the upper eyelid is where we have the lacrimal gland. The lacrimal gland produces tears, and it's going to secrete those tears inside the eyelid up inside here. The tears are going to be flushing over the surface of the eye, and then over here in the corner is where they drain. Now, you know, if you turn on a sink and you don't do anything and you just walk away from it, eventually the water going in the sink is going to overwhelm the drain's ability to get the water out. So when we begin to cry and begin to produce way more tears than normal, our drain can't keep up. And so the tears spill out over the surface of the lower lid and come down our face. Now, there are two drains. You might not even realize that. Do you see these little tiny holes? One here, and then there's one up here on the upper lid. Those are called the lacrimal puncta. Now, puncta is plural. Each one would be a lacrimal punctum, Punctum. So we have an upper lacrimal punctum and a lower lacrimal punctum. You don't have to say upper and lower. Now, if you follow the hole and move around here, you see that the hole, the punctum, leads to a small tube, which on this model has been colored pink. There's one leading from the upper one and one leading from the lower one. Now, these are little canals that are going to deliver the tears to here. These little canals are called the lacrimal canaliculi, just like we had in the bones. Okay, so the lacrimal canaliculi lead from the lacrimal puncta. Okay, and then they come together over here, and they're going to empty into something called the lacrimal sac. And the lacrimal sac leads down into the nose into something called the nasolacrimal duct. And you actually recycle your tears. You use them to wash your eyeball, and then you use them to keep the inside of your nose moist. Okay? All right, so those are the ones we can see just on the surface. Let me turn the model a little bit and show you that this piece comes off with all the things we just talked about. Okay? And now we can more clearly see what are called the extraocular eye muscles. Okay, there are 6 muscles that move this eyeball. There are 4 that go straight onto it, on the top, on the bottom, whoops, right in here, on the outside, and on the inside. If I turn it around backwards, you can see how these muscles are coming in here. There would be one here. You see where it's been cut away. There's one coming from the bottom. Those are going straight onto the eyeball. So they are called the rectus muscles. And so each muscle is named for where it is going on the eyeball. So this muscle here, this lower one, remember this one is levator palpebrae superioris. This one is going to the top side of the eyeball straight. So this is the superior rectus muscle. Okay, and you can see it attaching to the eyeball right here. This one that has been cut away is on the outer corner of the eye. This is the lateral rectus muscle. In here, way back here, there's one that's here, and you can kind of tell it's going to the medial side of the eyeball. That is the medial rectus. And then down, let me lean down here, under here on the bottom is one that's going straight to the bottom. That would be the inferior rectus. So we have superior rectus, lateral rectus, inferior rectus, and way back there, medial rectus. So that's 4 of the 6. If I look at the eye this way, they would be coming in superior rectus, lateral rectus, inferior rectus, medial rectus. Now we have 2 that come in at an angle. And if you remember, our word for at an angle in anatomy is oblique. One comes in from the bottom and kind of curves around like this. This is the inferior oblique muscle right there. And then we have one that comes in from the top. Now, this one's a little sneaky because if I go here to the top, I don't even see another muscle. I see my one from my eyelid. I see superior rectus. I don't see another muscle here on the top, but I do see a tendon. And this tendon is going to this pulley right here. And if I look back here, let me take this off for a minute. You can see that there is a muscle way in here, and then this muscle sends a tendon through the pulley, and that tendon is what hits the eyeball at an angle. So that is my superior oblique muscle. And it's kind of weird because that little pulley is called the trochlea, and this muscle is controlled by the trochlear nerve. Kind of cool how that worked out, huh? Okay, so superior oblique is there. Inferior oblique I see coming up here on the side. Superior rectus, lateral rectus. Inferior rectus is over here, and medial rectus is back here. So those are the extraocular muscles, and those are the external accessory structures of the eye.